हेलो एवरीवन, स्वागत है आपका एक और न्यू वीडियो में। आज मैं जा रहा हूँ डिबेट कंपटीशन सेकंड राउंड के लिए। आप भी हमारे साथ बने रहिए। हम दिखाते हैं आज 6 टीम सेलेक्ट हुई हैं, उनमें से कौन सा आज 3 फाइनल्स में जाएंगी। तो आप बने रहिए मेरे साथ। बस मैं थोड़ी देर में पहुँच के आपको दिखा रहा हूँ डिबेट कंपटीशन। अभी मैं आ गया यहाँ जीवेक्चुअली मेट्रो से निकल कर रोड क्रॉस करने के बाद ही हमारा सेकेंड कैंपस है UIB का। ये जो बिल्डिंग दिख रही है पीली वाली, ये सेकंड कैंपस है। अभी इसके में आज डिबेट है 5th फ्लोर पे, रूम नंबर 501। वहाँ भी चलते हैं हम। ये देखो अब अभी रिपेयरिंग हो रहा है ये स्ट्रीट लाइट्स के, क्योंकि अभी क्रिसमस आ रहा है। क्रिसमस के लिए सब कुछ बहुत अच्छे ढंग से सजाया जा रहा है। मैं आपको दिखाऊंगा क्रिसमस का ब्लॉग। अभी आज मैं दिखाऊंगा, अगर स्ट्रीट पे घूमने गया तो फिर मैं दिखाऊंगा कैसे सजाए हैं सब लोग यहाँ पे। मैं आ गया यहाँ अभी। अंदर यहानान, इसका भी आज डिबेट में है। फर्स्ट पार्टिसिपेंट है।
Every drug is negative because of the down least negative. What will happen? You know what will happen? And because the down regulation, you know what will happen is that everybody has a chance to use the substitute. There is no because it has being a doctor, you should accept this. That every drug has its own side effects. You are saying that we are saying that we are finding it properly. We are finding a way how we can minimize these side effects. If we talk about the cancer patients in present era, we give them opioids. Do you know how harmful are opioids? They are much more harmful than marijuana. Why you giving opioids? We have alternative methods. Marijuana instead of opioids. We have non-steroids method. Yes, what? Non-steroids method. Do you know?
But when we will legalize marijuana, it will remain as an option there to critically ill patients. We are not legalizing it for all people. We can make a card.
And sir, because of epidemiology, if a patient is ahead, these all will be died. In that case, what we can do? See, people can go for the surrogacy. Do you think that emotionally and ethnically or some other reasons we can dilute all these things?
Sir, may I speak something in that
Yeah.
topic? Sir, it is already being done now itself. Surrogacy was there in the artificial reproductive techniques. First IVF was done, then surrogate mother was she was recruited for the same purpose, and its horizons were in medical terms only. But sir, it is now being used that foreign parents, because their body should not be despaired, or they are not. They don't want physical relationship with both each other. That's why they're recruiting these women for this same purpose, and that is already happening. We should also take moral, ethical and legal considerations in this topic.
One point he said that like it's good thing that if someone is not having the baby, they are not in the capacity.
Yes.
They can go for this
Yes.
commercial or anything like that. What will happen to the emotions of the child after 10 years if he or she will come to know about
Yes.
this?
Yes. Hmm.
Will be the ethical values, will be there any sensitivity in the relationship after they will be fully mature?
This should be considered also.
This depend upon how they bring their child.
Different countries are there.
The
ये
constitution
लास्ट
of
थर्ड
India
डिबेट है।
was legally attacked by an agency, and they directly came up with the IPC section code 309, which was like they want to legalize euthanasia for the people. But so-called their argument was that they think it's okay for the people who are suffering from terminally ill disease because they can't tolerate the pain. It's so easy for them. It's a humane way for them to leave this planet. But there's also an article, thankfully, in India we have it. It's called Article 21, which is the right to life, which directly obliterated the whole of the argument. And in the Supreme Court, it was carried out in such a way that all the accompanies of such an act will be legal. Very good. Everybody is suffering. The staff is suffering because they have to take care of a patient that they know they are
And
they are
there is
a guest.
overburdened healthcare also. What do you think about that?
Well, healthcare is there just for the only reason. You can say it's a burden on them.
Overburdened.
We as a
Like
doctors are
sometimes-
there to clean this up. We're not there to complain. Oh, why are you sick? Why you come here every day? We're not bank employees like
I'm
we
not
have.
telling to
No,
complain.
you
I'm
are only
telling
taking the
that
doctor's point of view. What of the patient's point of view?
And
They
their
have
family
their
point of
own-
view.
Exactly.
own
You as a
dignity to
doctor
die. They
should
have-
know their point of view well than they do.
What about the
I'll tell you
emotions?
why. I'll tell you why. I'll
What
tell
is
you
the
why.
prolonged suffering
Do you
for
know?
the
Do you know?
patient
There's a
doing?
study. There's
What
a
about
study.
the psychological distress it's
Very
causing?
well.
What are the
You're
psychological
answering
distress?
on my behalf.
What about
Very
the
well.
healthcare, the finance
Psychology
problems of the
study.
families they face? What
I will
are
tell
you
you
going to say
everything.
about that?
I will
You're
give
only
you-
talking about the
I will
doctor
give you
saying
every
I know
single
exactly.
answer.
But the point is about lying with the patient. The patient wants to die. You are saying the doctor will save.
Okay, I will assist
And you
you
are
now.
not saying
I will
the
assist you.
The people
I will
who are
assist
gonna, who can be saved.
Okay, do I have the chance to speak now?
Yeah.
You said if the patient wants to die, why should a doctor interfere? That's your argument here? There's a study which states that 90% of the patients that they claim they want to die, they tell them to their medical representatives, all have depression. They all have depression. I will tell you the biggest reason for it. Let's say I, for some reason, God forbid, not me, if I get cancer for some reason, a doctor brings up to me like this, oh, sorry Hanan, you have cancer, you only have like 15 days to live, we can't do anything about it. If you put that in such a way, of course the patient, it's in their head. Psychology is the 80% medication of a human body, you know it. So if I put that in a way, if as a doctor you put it in such a way, of course the patient will be like, oh, there's nothing I can do. I can't even live happily because I know I'm going to die a painful death. But as a medical doctor, you should be more aware of these things. A doctor should always know what the patient needs, not what the patient wants. If it's what you believe in, what the patient wants,
विनर डिसाइड कर रहे हैं 6 टीम्स हैं 6 टीम्स में से 2 टीम्स आगे जाएंगी तो देखते हैं 2 टीम्स कौन कौन सी जाती है
Let's go. Let's see. We are excited to actually.
That's what
We
happened.
rooted for
Who will be the winner? Let's see.
Team wise, like Muzammil Ashraf and Zubairuddin Butt, Jan Saini and Harish Kumar. So the upper hand was from the Muzammil Ashraf and Zubairuddin Butt. The second it was Taban Qazi and Sheikh Sahil Hafiz. And Hanan Shabir and Nida Khan. Hanan Shabir and Nida Khan was the upper hand. Rakesh Reel and Sagar Gelot, Dishawat Tanwar and Kirti Saraswat.
Fighting for surrogacy.
Yeah, Disha Tanwar and we have to choose only one team, like two
teams.
Out of
Yeah.
the, now come to the winners. So like we have a
Final.
three like winners. Okay. So we have to choose a two.
Two.
Okay. So I think if we talk we talk about the winners, so it should be I think first Hanan
Shabir and
Nida
Nida
Khan.
Disha Tanwar
Because we have to use only two, so although it is very tough
That's why.
to choose the team from the winner.
खत्म हुआ आज के 2 विनर हुए फाइनल के लिए दिशा तनवर एंड कृति सारस्वत एंड सेकंड टीम इज हनान एंड निदा और अभी सर ने अनाउंस कर दिया विनर अब हम ब्लॉग क्लोज करते हैं दैट्स ऑल फॉर टुडे सब एक दूसरे से डिस्कस करें फाइनल के लिए
इतना कंप्लीट करना इजी बात नहीं है।
So it's the final words.
हाँ, yes.